Okay, well, I think we can go ahead and get started, and people will kind of just filter in as they can. We are recording the session, so I have went ahead and started the recording. Thank you all so much again for being here today. This is week 2 of the Digital Opportunity Champions program. This week we will be covering broadband as a social driver of health, which I'm really excited about. For those of you who may not have met me in the past, my name is Mira Sampath. I'm a member of the Health Information Technology and Telehealth team at the Office of Rural Health. Really glad to have you all here today to talk about this really important topic. So, with that, we will just dive right in. Let me. Alrighty. So to start, we like to, set some objectives. These kind of really set the tone for, the conversation in the workshop. So to start, the first objective is really to define broadband as a social driver of health. So really, we want to explain how is it that access to reliable high-speed internet impacts health outcomes and health equity. Another objective of today is really to examine the role of broadband in healthcare access. So we want to discuss telehealth, digital health resources, remote patient monitoring, and other technologies like that as key benefits of broadband connectivity. We'd also like to explore broadband's impact on social and economic well-being. So highlighting how broadband access influences education, employment, and social services, all of which contribute to a person's overall health. And finally, identifying barriers to broadband access. So, addressing disparities in rural, low-income communities, and discussing affordability, infrastructure, and digital literacy challenges. So to start with, we have this graphic, and I really think it's a great summation of the topic that we're going to be talking about today. The takeaway from this graphic is you looking at how digital literacy, broadband connectivity, and device availability impact all of the other social drivers of health. So if you see the digital literacy and access, device access are all in the center, and surrounding you have all of the other social drivers of health and that are impacted by the center topic. So for example, economic sustainability, whether that be your shopping choices, online banking, employment, your ability to pay your medical bills, all of those are impacted by, your ability to access broadband and your digital literacy. In the healthcare system, we now have wearable sensors or remote patient monitoring devices. Your ability to access healthcare coverage. So whether that be to sign up for health insurance or to recognize what the benefits are of your health insurance, a lot of that is online. Um, Telehealth, of course, is online. Patient portals and health apps. Again, all of these really require that digital literacy and broadband connectivity. In the community and social context, you have support systems, oftentimes for people to stay connected with their loved ones or other support systems. They use social media, whether that be email or any other social media platform, video conferencing. These can all be really important tools in that context. Community engagement as well, similarly, to stay engaged in your community. Oftentimes, it's really helpful to have those online tools that you can leverage. And the news, of course, is so predominantly online now. Food. So whether if you're food insecure, if you have broadband connectivity and the skills to use, the internet, you can look up information about food banks or safety net programs or how to access fresh food delivery. Really just resources that could help you mitigate that food insecurity. Education, as we all know, during the pandemic, so many educational institutions went fully virtual. So transitioned from in-person, lectures or classes to fully virtual. So the role of broadband connectivity and digital skills in education nowadays cannot be understated. But it also impacts your ability to access higher education, other vocational training, and early childhood education as well, because as we know, not just higher education, but elementary schools, middle schools, high schools, they also did virtual learning or e-learning during the pandemic and have continued that actually throughout after the pandemic as well. In the event of teacher work days or inclement weather, virtual learning is something that's still being implemented. So obviously, again, your ability to not just have broadband, but access that internet and use it efficiently impacts your ability to access those services. And then neighborhood and physical safety. I think often an underlooked topic, but housing. I mean, oftentimes now your ability to access housing is online, whether that be like apartments.com or some other website where you can look and see affordable housing options or apply for, Section 8 or other, federal or state programs are online. Transportation, even the public transportation, oftentimes now, the buses or things like that, they have their schedules online or they have an app that shows you the schedule. So again, whether or not you have a device, whether or not you have the skills impacts your ability to use those services. So again, to really sum it up, we really think that, your ability to access broadband, your ability to have a device, and digital literacy and skills impact all the other social drivers of health as well. So again, in summation, access to high-speed internet really plays a big role in people's health, whether that be by making it easier to get medical care, to learn about health, find jobs, or to stay connected. So, what is the role of broadband specifically in healthcare access? Because I think that's really what we want to, focus in on for the purposes of this session. So, these are the topics we're going to cover a little more in detail, but I'd just like to go through them really quickly. Better access to healthcare, improving access to health information, supporting basic needs that affect health, um, closing the gap in healthcare access, and improving public health and emergency response. So I just wanted to touch on those briefly before we kind of go into more details on those topics. So better access to healthcare. Of course, telehealth is probably the most thing that comes up the most. People can talk to their doctors from their homes, which can really be beneficial in rural areas or even for those who don't really have a reliable source of transportation. So really, it can be that telehealth can be that main piece that helps you from going from not having care to accessing care. Remote health monitoring or remote patient monitoring. Again, there are some medical devices that can send information to doctors about patients, which really helps patients with long term health conditions or chronic conditions who otherwise may not be able to have an in person appointment or may lack, again, the transportation or other resources that they need in order to have those in person appointments. So, we are going to talk more about different telehealth platforms and remote patient monitoring in a few weeks as we kind of move through this workshop series, but we did want to touch on that. Um, I also kind of wanted to give an example, of these topics in the context of North Carolina and just our general situation. So, in rural North Carolina, of course, many people live really far away from doctors and hospitals. In my experience, talking to patients in rural areas, oftentimes they are going a county or two counties over in order to access health care. Um, so when the COVID-19 pandemic hit, one of the things that clinics did was to partner with local libraries and community centers. And so they could provide that high speed internet access so that patients could attend virtual doctor's visits. So this was really, really impactful for people with chronic illness, like diabetes or high blood pressure. It helped them receive regular care without having to travel that long distance. And of course, during the pandemic, it allowed them to receive that care without, additional exposure to COVID-19. So again, these technologies can be really impactful, but we're doing ourselves a disservice, I think, if we talk about the technologies, but we don't talk about the underlying issues that might exist to access those technologies. So, in the context of health information and learning, so if you have access to broadband, it can be a lot easier to find health resources. So, with the internet, people can look up medical advice or they can Google their symptoms and learn about ways to stay healthy. We do want to emphasize, of course, that it's important to evaluate the quality of the health information that you find online. Not all the information that you can find is reliable. However, there is a lot of reliable information out there, but people just need the skills necessary to be able to locate that information. And that can be really helpful, and using digital health tools. So, again, a lot of healthcare offices now use online appointment systems and patient portals. And these can be really helpful in so many different ways, right? For patients, a lot of times, those patient portals are what help you access a telehealth appointment. You can send a message to your healthcare provider without needing to call the office. You can put in a prescription refill, right? You can pay your medical bills or view your medical bills. You can also view labs, test results. So there's so many benefits to that, online appointment system or patient portal. But again, without internet access, many people are unable to access these tools that could really have a great impact on their health. So again, to give you kind of another example in context, during the pandemic, many low-income students in cities like Detroit and Chicago struggled with online learning because they didn't have reliable internet access at home. And then without access to these school resources, these students fell behind academically, which again can impact your future job opportunities and your health in the long term. So, to mitigate this, many of those cities launched programs providing free Wi Fi hotspots and low cost broadband programs to families in need. So, really, to state again, we are a lot of us are in the digital skills realm or in the device access realm, but that broadband is really sometimes that foundational piece that impacts people's ability to gain these skills, and to access these helpful tools. So again, how does broadband support basic needs that affect health? Well, jobs and money. People can use the internet to find and apply to jobs. Oftentimes now, after the pandemic, it's very common. Remote work has become very common, so people can work remotely. People can access online job training. And all of these things can really impact your ability to earn an income and support your family and support yourself. Um, Also, online banking has become a really big thing. So, if you do apply for a job and you do get a job, your ability to track whether your salary is being deposited in your account or set up a direct deposit. Again, these are all skills that you need to have. But if you don't have access to broadband, it's really difficult to acquire these skills. Education and child development. So, for children to have access to internet and be able to do their schoolwork, which oftentimes, again, is online or requires the use of some kind of online tool like Microsoft Word. Again, attending virtual or online school. So during the pandemic, all school went virtual. But now I think a lot of schools since they have the setup and the infrastructure during inclement weather or other scenarios like that, they do have virtual learning. But those students that don't have broadband or don't have a device, they're falling behind compared to their peers for no fault of their own, just because they don't have access to these things. And additionally, using learning tools that can help with future success. So again, there's so many online learning tools now. Even in schools, they have iPads or other computers and things like that. But if you don't have those devices at home, you can't continue to apply those skills or continue to learn in that way. So it really does have an impact on these basic needs, again, which affect your health as well. So, and with regard to closing the gap in healthcare access. So, in many rural or low income communities, they do not have reliable internet, which makes it harder to access healthcare. So, of course, expansion of broadband access can improve this. Again, whether that be via telehealth, whether that be via remote patient monitoring visits, all of those things can be improved again if you have broadband access. Supporting older adults and folks with disabilities. So, internet access can allow older adults and those with disabilities to access virtual care, to use smart home devices, which might be helpful to them, and to find support groups online as well. So, again, to kind of put this in context, in Florida, there was a senior care center that started using remote patient monitoring devices to check heart rate, blood pressure, and oxygen levels. These devices send that data to doctors through the internet, allowing seniors to receive care without having to do frequent in person visits. However, of course, some seniors without internet access couldn't use these tools, which put them at higher risk for health complications. So, expanding broadband in senior living communities has helped more older adults benefit from these life saving technologies. Um, so, that kind of puts it in context of again how important and vital broadband access is when we talk about digital skills, digital literacy. So going into improving public health and emergency response, which could not be more relevant, I think, right now in the past year within North Carolina. So in terms of broadband connectivity during crises like weather disasters or pandemics, the internet helps people get updates, whether that be about the weather or the conditions in their area. Allows folks to attend school remotely if they're doing that, and find support and resources. The internet access also allows health organizations or community health programs to reach more people with important health information. So again, to kind of put it in context, going back to all the way back to 2017, when Hurricane Maria hit Puerto Rico, many communities lost internet access, which made it really difficult for them to receive health updates and emergency assistance. So there were some organizations such as NetHope, which set up emergency Wi-Fi hotspots, allowing people to contact doctors, get disaster relief information, and reconnect with their loved ones. We actually also saw this recently, last October during Hurricane Helene. A lot of people, again, immediately lost internet connection during the aftermath of the natural disaster. However, one of the first things that was being done in the area were, the Starlink satellites, or whether that be, there were several telecom providers actually that created mobile vans with satellite internet, and they were kind of moving throughout the area. And this was really important because the internet access really became vital at that point for several reasons, whether that be for people to apply for federal or state assistance programs. All of that was done online. Whether that be to contact their loved ones or their friends whom they didn't know where they were, didn't know their location, weren't able to get in contact with them. Whether that be to call their doctor or any other healthcare provider to ask questions about health conditions they were experiencing, or how can they get a refill of their medication. So really, I think in the aftermaths of these disasters, we see how crucial it is, for internet access. And it is during these natural disasters, which I think are also health crises, right? And so I can't understate enough, especially again in North Carolina with the aftermath of Hurricane Helene, the recent wildfires, how important it can be during those times to have broadband connectivity, and how that impacts, that can have a really positive impact on mitigating these negative impacts to your health outcomes. So again, some communities, especially low income and rural areas, have limited or no internet access, which makes it difficult for them to get medical care, to learn about health, or to find jobs. So, what are these barriers to broadband access? Again, many communities still struggle with reliable internet access due to several key barriers. These challenges contribute to what we call the digital divide, which makes it harder for people to access healthcare, education, and job opportunities. So, we're going to go into a little more detail about what these barriers are specifically. So, of course, there are infrastructure challenges, right? In rural and remote areas, many rural communities lack the infrastructure for broadband because internet providers find it too expensive to build networks in sparsely populated areas. So, oftentimes for internet providers, it's really difficult to find that initial capital that they need. It's a pretty significant investment if there's no infrastructure at all in rural areas. And those areas do exist in North Carolina. For them to go out there and just build the infrastructure from the ground up can be really expensive. And so a lot of them are not, unless they're incentivized to do so, many of them are not, doing that. um, Outdated technology. So some areas still use slow DSL or again satellite connections, which cannot effectively support telehealth or remote work. So for telehealth and remote work, oftentimes you really do need a higher bandwidth. So you need that high speed broadband connection. So there are areas where they have broadband, but again, it's slow. The speeds are not fast enough. The upload download speeds are not enough to sustain a telehealth visit, a video conferencing platform, or your remote work, which oftentimes remote work does involve a lot of meetings. So you may need, again, that higher bandwidth. Of course, high costs, right? So even if you do have broadband, let's say you have the infrastructure in your area, it may be too expensive for you to actually be able to afford to purchase that plan. So many low income households can't afford high speed internet, even if that's available to you in your area, if the infrastructure exists. Um, Of course, then we have the cost of devices because even if you have broadband and you purchase that plan, without a device, you can't use that broadband. So laptops, tablets, smartphones are necessary for internet access, but often they're too expensive for some families. So again, the infrastructure being there is just one part of it. There's still gaps that exist to your ability to access the internet. Digital skills gaps. So, so far we've talked about the lack of broadband, right? The lack of infrastructure. We've touched on the lack of access to devices. However, assuming that both of those are intact, right? You have the infrastructure, you are able to purchase a broadband plan, you're able to purchase a device. There still exists a gap. There's still a gap that's not being filled, and that's the digital skills gap. So, if you don't have the skills necessary to effectively use the devices, then in a way you're still facing a barrier to using these devices effectively to meet your own needs. So many communities lack digital skills programs to teach people to navigate computers or smartphones or tablets and the internet safely and effectively. And as a result, some individuals, which is often older adults and those who live in rural areas, they struggle to use these online tools like telehealth apps, digital job applications, and patient portals, again, which has a pretty significant impact, on their health. To put this into context, I can talk a little bit about the work that our team has personally been doing over the past year and a half. So, me and my colleague, we have created a digital skills and a health language curriculum. Um, and each of these curriculums, they cover a wide variety of topics on a foundational level. And we are currently, piloting these curricula to see if they're actually effective and if they're useful to people in rural areas or underserved patients. But for example, in our digital skills curriculum, we don't make an assumption of what skills people might have. We really, again, start from that foundational level of like, what is a computer? What is the keyboard? What is a trackpad? What's a mouse? How do they work? And we go from there to several different topics that we think can cover, again, not just health topics, but social drivers of health as well. So while we do have a section on, researching health information online and how do you know that information is reliable, we also touch on how to make an email account and how to write an email. Because again, your ability to find a job is something that directly impacts your health, right? Your ability to earn an income. We also touch on, for example, social media, because again, your ability to stay connected with your community, your loved ones, has a direct impact on your health. We also cover online safety and privacy, which I think we're going to touch on a little bit here as well. But when we were, doing some of that grassroots work and trying to ask people, where is your hesitation in using these devices if you do have access to them? A lot of people said, well, we're scared that we're going to get scammed or that someone's going to steal our data. And so we thought building that into a digital skills curriculum, teaching the skills and then placing in that context of here's how you can keep yourself safe while you learn these skills. We thought maybe that would reduce, some of the hesitation around this. And of course, there are several great organizations throughout North Carolina that are working to address the digital divide, especially with digital literacy and digital skills as well. So we hope that, there are several organizations also addressing, broadband access, device access, and digital skills. And I think the combination of these three kinds of programs can really effectively bridge that digital divide. So, language and accessibility barriers. So, many online health resources and government programs are not available in languages other than English. Additionally, there are folks that have visual, hearing, or physical disabilities that may struggle with poorly designed websites and digital tools. So, again, we have talked about broadband throughout this, but even if you have broadband, even if you have the device, there are still barriers that exist for you to be able to effectively meet your own needs with these technologies. So again, a lack of policy and regulation. So in certain areas, there's only one internet provider that's available, and that leads to higher prices and poorer service. The fewer options you have, you're kind of forced into an expensive plan. You may not be able to afford that plan in the first place. So even if you have a device, if you don't have the internet because it's too expensive, again, that again is a barrier, right? And then again, broadband expansion efforts often rely on government funding. So I'd be remiss if I didn't mention the Affordable Connectivity Program, right? Which was this federal program that provided discounts on internet services and devices for eligible low-income households. It offered a discount of up to $30 per month. I think it actually reduced the price to $30 a month for broadband service and up to $100 for a one-time device purchase. Um, However, unfortunately, that program did end. It's saying June 1st, but I want to say it was earlier than that, in 2024, due to a lack of additional funding to support that. And so, again, oftentimes, like I mentioned before, for a broadband provider, if they don't have an incentive or some kind of funding provided to build that infrastructure in rural areas as well, or to provide low cost service, they're often not that inclined to do so. There is some great work again going on in North Carolina around broadband expansion efforts and an attempt to fund these efforts. Of course, there's the BEAD funding, which I'm sure many of you have heard about. There is also the Completing Access to Broadband project being run by NCDIT, which again is incentivizing broadband providers to go into these rural areas and build that infrastructure in order to provide last mile coverage. And so thankfully, I think North Carolina is really on the forefront of these efforts, and they are really working. The current administration is really working to address these gaps. And so really excited about the possibilities of that. But in spite of that, again, there will still be, even if we manage to achieve last mile coverage, we still do have a long way to go. As we've talked about, there are several other barriers that we will have to work to mitigate. And again, trust and privacy concerns. So I did mention this a bit earlier, but a lot of people avoid using the internet for healthcare and financial services because they're concerned about scams or identity theft. And some communities may distrust online healthcare as well due to past experiences or data privacy concerns. So prior to working at the Office of Rural Health, I actually worked at a primary care clinic with older adults. And a lot of them felt like, they would get a lower standard of care if they used a telehealth appointment. They felt like, oh, I'm going to get better care if I'm in person. Or again, they were worried that, someone who wasn't a doctor would call, or, with somebody who didn't need to have access to their information would obtain access to their information somehow. And so these are really concerns that, we have to kind of work to build an understanding about, I think, especially for older adults and those that can really benefit from accessing these services. So I've done a lot of talking for the past like 30 minutes. So I really just want to throw the question out to you all and really just this is an open floor discussion, whether it be about this question or just anything we've kind of talked about today. So the question we want to encourage you all to think about really is how do you think you can play a role in overcoming those barriers? Whether, whatever kind of work your organization does, we've talked about so many different barriers today, so many different topics. Where do you all see your organization or you specifically, your role within that organization kind of working, to mitigate these barriers? And you can also ask questions about anything else we covered. So we'll start with Lucette.
Hi, everybody. We at Southeastern Healthcare, on our nonprofit side of the house, we have an adult day care program. So we work with not only seniors with some diagnosis of dementia, but we also work with their family members. We provide support services, education, and resources. So one of the first things that would come to my mind would be hosting a series of webinars or seminars. And I think it's kind of funny to say webinars given the discussion, but a series of webinars or seminars where we're able to explain to the family members, the primary support providers, how, quite frankly, how internet access has become a critical part of healthcare and accessing resources. And I think that would be one of the earliest things that could be done. But on top of that, I wanted to also recognize, because I live in a very rural part of North Carolina, and what's really odd about this is that prior to moving here, I worked for a cable company called Comcast.
Okay.
Yeah, and it was very difficult moving to this rural part of the state because we had literally no meaningful Wi-Fi service available to us, and that was maddening to me because I was accustomed to having the fastest speeds available at my disposal. Well, recently, with the funding that was made available to overbuilders and providers, um, we recently got Spectrum to run lines out on in our area, and I think I may have been one of their very first customers on that street because I was so desperate for it. But the difference between having access to that type of service versus sort of the and I'm putting this in hard quotation marks, um, high speed internet that was coming, quite frankly, through the old phone company, it was night and day. And so being able to encourage people to look at this as a new opportunity. But I also think one of the other things that you might want to communicate to these family members, as more and more smart TVs, Fire Sticks, that type of technology, and even with the new threat of public television programming being made available through streaming services, having that access becomes really important to other aspects of day to day living in those households. So, those are the first things that come to my mind.
Yeah, absolutely. And it's really interesting you mentioned that you used to work for Comcast, 'cause I think you bring a completely different, perspective to the conversation. But I think you're absolutely right. I do think there needs to be education for, rural residents and underserved residents to really understand the role that, broadband access can play in their lives and how it can improve their health outcomes for sure. Yeah, great points. Other thoughts? Cynthia?
Hi. Yeah. One of the things too with the telehealth and is and older adults, because that's who I work with, are older adults, and I am an older adult. So the privacy is a big issue. Although I will sit down there next to them and they're willing to have me put in all the information, including their social security number, their insurance numbers, their Medicare numbers, their Medicaid number, whatever, which, I'm an anthropologist by training. I, and I don't remember numbers anyway, so it's not gonna be an issue for me, but the difference between in-person and not in-person care, that the machine is gonna do something that with that data that the person doesn't. I'm next to them, they know me, I'm okay. The machine is not okay. It's an other that's not threatening. They're not afraid of it. I mean, that the idea that older adults are afraid of technology is kind of a misnomer. They're afraid of being talked down to because they don't know. And, and that's part of it. But sitting down with them and talking to them about security and passwords. And I tell people, write them down, because when you start talking about the password savers
Mhm.
and how do you get that type of thing, they get confused because, again, it's taking them a whole step beyond what their comfort level is at that moment, especially if they're beginners with the technology. So write it down, keep it in a safe spot, put it in a locked drawer or something. But the first thing I do with them, even if it's online banking, not telehealth, is show them where on their browser they can go incognito or private browsing, whatever that is, and explain to them what that does and how it differs from just doing a straight Google search when Google pops up. And one of the things I find then is that they've got a greater sense of security. One, because it's an added layer of protection they didn't anticipate.
Right. Yeah.
Yeah. And remind them that even though it's online, that HIPAA requirement is still present.
Right. And I do want to say, I think really quickly, one of the points that you made about, bringing the digital skills into context based on your audience, right? Like, not just a blanket sort of, this was really important to us when we were building out our digital skills curriculum as well. So I'll give you an example. A lot of us, we wanted to really focus in on like healthcare specifically. So we were going to build our whole digital skills curriculum about, healthcare related topics, right? But we found that for people, oftentimes like the health context, if you don't have broadband and you don't have a device, for example, then you're like, why am I learning about this? I don't even have access to that. And so building in things that are like in the context of people's lives. So for example, there's a section in our curriculum about online calendars because we felt like, again, that's something you can use. There may be people who can use that to track their appointments or things like that. So not necessarily putting it in a health context specifically, but thinking about like, how are people really going to use this in their lives, right? So you talked about the password saver, right? For an older, adult audience, it's probably more effective to tell them to write it down, right? It might be more complicated for them to use a password saver. So I really like the point you made about thinking about the context of the audience that you're going to approach. I thought that was really cool. But Fred?
Yeah, I was just going to say, I work for an organization up in Western North Carolina,
Mhm.
and the telehealth aspects and the digital literacy and broadband aspects are really important to us right now after Hurricane Helene. And we're trying to think of resiliency. How are we going to be resilient for the next Helene? And for everybody on this call, the question is, what are you going to do when Helene hits you? And focusing on all the aspects that you're talking about in advance is going to be so important to try to recover from whatever happens. And we all know something's going to happen. Not to be doom and gloom, but weather events are happening. So being ready with these technologies and the skills is on top of our minds.
Yeah, absolutely. And I do want to share, I will say, that what you're saying is absolutely a priority. So I am in a lot of these, digital inclusion spaces. And yes, when after Hurricane Helene, really the topic has been exactly what you said. How can we build that resiliency in advance of these, right? Because I'm thinking like typically when we think of, hurricanes or natural disasters, we're thinking like Eastern North Carolina, right? So it was a surprise that it came to Western North Carolina, but I think that truly showed like across the state, we need to have this preparedness in advance, because it's a lot more difficult to try and build that in the midst of this kind of crisis. So I have put a link in the chat. I'm sure some of you have already seen this, but that's the North Carolina digital plan, basically the digital inclusion plan. And so that lays out really the state's priorities in this realm about how they want to bridge the digital divide. But there are also several coalitions across the state that are working to build these plans, regionally, and really address some of the things that you've talked about. So I know I was involved in the Mid-East coalition. I'm sure some of you are aware of that. And so we had a really big conversation, after Hurricane Helene about, again, those resiliency networks. And so, yeah, certainly something to think about. I know one thing that they built into their plan that we had talked about was I think satellite backup in public access locations. So having, any location that has public Wi-Fi, maybe like a state building or a county building, having a satellite backup. So in the aftermath of some kind of natural disaster, there's a backup for all of those public Wi-Fi access points. So as you work to restore broadband, to each individual home, you still have those public access points where people can gather and again use that internet to access, vital services like applying for disaster assistance or healthcare and things like that. So I think that's one of the things they talked about. But yeah, definitely again, very incredibly relevant for North Carolina, especially in the past year for sure. Yeah, Cynthia.
One of the things with the resilience, I am in Eastern North Carolina. I've been Irene, Florence. Um, a lot of people will say, well, why can't we put utilities underground? Water's an issue. And water's not just an issue here, it's an issue anywhere. If you get a break in the conduit and water gets in, your fiber optic is gone. You can short out electricity, phone service, all those types of things that are we think of as normal infrastructure utilities will have a problem underground. That's why we maintain a lot of our stuff above ground. It's much easier to replace to find the problem and fix it on a pole than it is underground. The other aspect of that is that we run all these lines down public infrastructure, which is the right of way alongside a road. And right of way is determined by the type of road. So state and federal roads, county roads will have public right of way. If it's a private road, if it's into a development, it may not necessarily have the same right of way issues or protections that provides that service. So, and the other thing about the infrastructure, and broadband is not considered critical infrastructure. It's not electricity. It's not that landline for your phone, which is still priority in planning, even though a significant portion of people in the United States no longer maintain a landline. So part of it is advocating for a change in the way broadband is viewed in terms of as a critical need. It's not a luxury. It's an essential part of everyday life for most of us.
Yeah, absolutely. Lucette?
I really agree with you. The thought of broadband not being treated as a standard utility is really very short-sighted, and I think this far into the development of broadband and the internet and everything that's so dependent on it, this really has become a very serious issue that needs to be addressed. I think it absolutely is an essential or critical part of infrastructure and should be looked upon as a utility. The fact of the matter is the experiences that we've had with landline companies to differentiate them, power companies, etc. Those things over the development of technology and time and wiring homes. I think that I think we're way past the early inception of broadband, to use the collective term, and there really needs to be a look at this as a major utility anymore.
Absolutely. Fred?
Again, I can't agree more with Lucette and Cynthia. We just had maps provided to us by the Benton Institute of broadband actual coverage based on speed test pings versus what the companies claim are covered. And it's pure fantasy. So when I look at some of our rural counties and they say, you have 100 up and 10 down or whatever it is, and I'm out there with a device, it's like going back to aluminum foil on rabbit ears. trying to verify what they claim. And so accountability and responsibility in rural North Carolina from our suppliers, to me, of course, it's a government issue, but my God, some of the claims are just, fantasy. And I guess it goes back to my frustration. Cynthia's heard this from me before because we work in the same program. But the definition of rural, I want to drive to Mecklenburg County and to Wake County, the urban counties, and I want to scream from the mountaintop, you need to come see what rural is and experience it. And maybe your vision for the future would be different.
Yeah, absolutely. These are such, I mean, I couldn't agree more with everything that's being said. I also do want to share, I'm going to put a link in the chat. The FCC is currently doing speed tests in order to determine, bringing 5G to rural areas. So I do want to share that website. There's an app that you can download. We would need to conduct the speed test in throughout different regions of North Carolina. And they're using those speed tests to determine, where does broadband infrastructure need to be expanded, specifically as it relates to 5G coverage. So I would encourage everyone possible to download that app. There's a set of instructions on the website as well, and to conduct these speed tests, because again, the more data that the FCC has, the greater the chances are that they'll be able to pinpoint which are the regions of North Carolina that really need that expansion of access. But yeah, I do agree. I think that broadband is often looked upon as something frivolous. I think like people are thinking like, oh yeah, you're just streaming Netflix or watching a video on YouTube or listening to music or something like that. And that's why I think we put this presentation together in the first place, really just to outline, it's not frivolous. It really impacts not just like specifically healthcare related things, but other social drivers of health. Again, all of which impact your health outcomes. And so, yeah, could not agree more with everything that you all have said. And with that, we did have this slide. We wanted to talk briefly about overcoming barriers. We've touched on so much of this, but again, infrastructure investments, which I think are definitely happening in North Carolina. So it's really great to hear about all of that. Affordable internet programs. Additionally, related to that, I also want to share this. I'm sure, again, many of you may have seen this, but in case you haven't, the National Digital Inclusion Alliance does have a repository. They created this after the Affordable Connectivity Program winded down. It has a list of affordable programs in North Carolina. I think it goes by state. So if that's a helpful resource, just wanted to share that as well. Digital skills training. Again, lots of great organizations doing that. And the curriculum that, me and my team have designed, we do hope after we test it, make sure it's effective, that we can launch that statewide. So it's available to anyone who wants to do that sort of education. And then inclusive online resources, as we mentioned, mitigating language barriers and things like that. So again, to open the floor again, Lucette, I think you had your hand up.
Yeah, one of the other things is really utilizing community health workers in this as we take a look at the curriculum that's being developed. I think it's important that we bring that into view with community health workers that are being deployed in various programs to help with that education, help with filling out applications for any affordable internet programs that become available, and then using these trusted members of community to conduct trainings, to be able to educate people very much in the same way that this was done during the pandemic. Doing education around COVID, around, hesitancy for getting tested and vaccinated, and using community health workers to really help to get this information into communities and to get programs set up would be another very effective way for getting this information out and getting people connected with this type of service, with this type of utility.
Yeah, Absolutely. Can't understate again the importance of community health workers. You know, they have those relationships already inbuilt with the community. They have community trust. And so again, relying on those trusted members of the community to disseminate information like this, definitely a really great idea. Cynthia?
Yeah, one just last thing. All of the broadband providers in my area, at least, which that's Spectrum, AT&T, Brightspeed, and Optimum. If you ask, they have senior programs.
Yes.
They also have low-cost programs. You have to ask, and they will try to upsell you. But they've realized they're missing customers by not providing services. One of the things I like about Brightspeed is they will walk through the senior on what they want, what they need, and what the different levels do. So if all you want to do is, telehealth, but you're not interested in streaming or anything like that, this is what you need. This is the kind of the basic broadband package. You got to ask them. It's the same thing with cell phones. All the cell phone companies provide senior packages, all the major ones, but they don't advertise. So you have to ask. And that letting them know that, and it's okay to ask, is, part of empowering them to advocate for themselves.
Yeah, absolutely. Many may not even be aware of the resources that are available to them. So again, letting them know what options you have, and again, teaching them that self-advocacy piece, right? You can ask for lower rates. They might try to upsell you, but you can advocate for yourself, I think is definitely really important as well. Awesome. Other thoughts, questions about anything that was presented today or just in general relating to this topic?
I look forward to you launching your program so that we get access to it, because ready-made curriculum on specialized topics for rural North Carolina, hard to come by.
Well, that's great to hear. It's always great to hear that what we might be developing is definitely filling a need that already exists, right? That was really important to us. So yeah, we will definitely look forward to reaching out to all of you when we're able to launch that resource statewide for sure. But thank you so much for that feedback, because it does help put things into perspective for us as we work on developing this out for sure.
Yeah, it can't be understated, the need. So we're waiting for what you've produced. Thank you.
Yeah. Awesome. Thank you so much for sharing that. We are coming up on the hour, so really quickly, I want to share, let's see, the link for the knowledge check. So I think my colleague Courtney ran the sessions last week. She probably mentioned this, but we do have some short, kind of quiz type knowledge checks that we have developed. And basically, we're going to provide a certificate of completion at the end of this workshop series. So that's how we're going to track it. So we'll track it based on your completion of these little short 3-question knowledge checks, and then we'll be able to provide you with that certificate. So I have shared that in the chat. I will also send that out via email to you all. But yeah, if you can complete, if you complete those knowledge checks, again, we'll be able to track your progress, and we'll be able to provide you with that certificate of completion at the end of the workshop. Yes, Lucette.
I'm sorry, there's just one other thing that comes to mind.
Please.
Would there be a value in offering this series as a part of the AHEC, MAHEC curriculum, as a part of the, the training that's made available through that platform? I think there would be a number of people very interested in doing this, and certainly as part of the requirements for contact hours for CHWs and other professions, this could be very helpful. So it's my recommendation that that be something that is explored for this series.
Yes, absolutely. So we are definitely looking into that partnership for sure. And we are in touch with AHEC and kind of seeing how we can make that work. I think we wanted to kind of launch the series and see what interest looks like. You know, are these topics people want to learn about? But to say the interest has been so great is an understatement, honestly. I mean, we were pretty surprised with how much interest there was. So yeah, we are definitely looking into that. I think that would allow us to expand our reach a lot more, and again, I think potentially provide continuing education credits as opposed to like a certificate of completion. So yes, thank you for bringing that up. We're definitely looking into that for sure for future iterations of this series.
I kind of have community colleges on my mind too, but that may be long in the future.
Yeah, absolutely. We do have some connections with the Community College Association as well. So, yeah, definitely looking on how we can leverage partnerships across the state, really to get this to as many people as possible. But as we're coming up on the hour, I will just say I'm going to hang around and we can continue our discussions. This has been really great. But if anyone does need to drop, I just want to say thank you so much for joining us this week. Again, the link to the assessment is in the chat, and I will also email that out. Feel free to reach out to me or my colleague Courtney if you have any questions. And we just appreciate your participation and engagement so much. And for those of you that have to drop, I will see you next week. But again, I'm hanging out and we can continue our discussions for those of you that want to hang out for a bit. Thanks so much, y'all.
Mira,
Hmm?
are you aware of the program that, the project that ECU's been running? Leslie Kofi is the principal investigator there.
I don't think I am, no.
Okay, so, I'll have to find it and send it to you. They